We're going to go ahead and get started so that way we'll have a little bit extra time at the end for questions. It is my pleasure to introduce our speaker, Mr. John DiMaggio. He is the CEO of Blue Orange Compliance, and I've known John for quite a few years. John is the co-founder of Blue Orange Compliance, also serving in the CEO role. It's a firm dedicated to helping healthcare providers and business associates navigate the required HIPAA and high-tech privacy and security regulations. John is a recognized healthcare information compliance speaker to the state bar associations, healthcare organizations, including HIMSS, LTPAC, NAHC, Leading Edge, OHCA, and Alpha. John's extensive healthcare experience includes being the CIO with NCS Healthcare and Omnicare, senior operations roles with Neighbor Care and general consulting to the industry. John began his career as a key expert at Pricewaterhouse in their advanced technology group and served on several national and international standards organizations, including the American National Standards Institute and the International Standards Organization. John is a named inventor on several healthcare technology and process patents, holds an MBA in finance from Katz Graduate School of Business and a BS in computer science from the University of Pittsburgh. And I do have the pleasure of working with John from time to time on projects, and I can tell you, this man is an expert in HIPAA and privacy. If you are an organization that does have questions and needs assistance in that area, I'm telling you, talk to this guy right here. Does a great job. I hear feedback from his clients all the time. I work with a lot of the hospitals throughout the state, get nothing but great feedback on Blue Orange Compliance. With that, I'll turn it over to John.
Thank you. So if you are here, you're probably worried about how you're going to get caught, right? So, or the audit. So we're going to go through the audit protocol. We're going to set the stage with privacy and security requirements, talk about the protocol and how to prepare, and how many people have been gone through a meaningful use audit here. Okay, yeah, so these are a little bit different. We'll talk about that. That's me, Scott just went through that. Scott just went through that, so kind of what we do. So I'm going to start with the slide and end with the slide. So these are some questions to ask about your organization. So have you done one if you're in acute care? How many long-term care people do we have here today? Or long? Okay, part of that. So if you're in acute care, you've done one of these, or you've probably won the past for meaningful use audit. Has been done, updated regularly. Do you have a plan? And policies and procedures. I'm going to talk about that a couple different ways. And we're out there, we find a lot of organizations, there are significant changes in 2013. Have they been updated since then? And training. Training is huge. So you can have a set of policies and procedures in a binder. That usually doesn't cut it. People have to understand and live in this organization. And any security officers in here? Okay, short straw. How about privacy officer? That's a really short straw. Okay. So, you'll have gone through number 7, at least at a high level, by the time we're done here. So, healthcare landscape, healthcare going along at breakneck speed, going electronic. Now they're trying to get people push the cost outside the 4 walls to be taken care of at home. Acute care started out running in 2010. Incentives involve meaningful use, and long-term care started to push information out to the rest of the world. So since then, we've got all kinds of technology enablers. We have the cloud. We have all kinds of devices, Internet of Things. You can connect basically to anything, anywhere. Increases a large attack surface, I guess, where all the information is. And healthcare is behind the rest of the world. I think we're kind of aware of that for a couple reasons. We've been brought into this at a very, very fast pace due to the incentives, and with all the other stuff going on, the street value of this information is a lot more than financial. So you have this increased attack surface. You have we're a little behind, and you have the value of information is high. So it creates a situation, a kind of a perfect storm. So we'll talk about privacy and security, is going to tee up the protocol. So under regulations, we're going to go through these, the privacy, security, and breach as it relates to HIPAA. You got 5 organizations that are enforcing this. We're going to talk mostly about the OCR, Office of Civil Rights. And you have a lot of different threats. I mean, malicious outsider is the one that's getting most attention as far as hackers and ransomware. But you have people inside your organization, right, that have a lot of access to information. So that is also a threat. People make mistakes. People forget to change administrative passwords. People forget to close off firewalls. People, implement systems that maybe haven't been checked. So that's also a potential. And environmental. Brian talked about availability. So if there's an incident that renders your systems unavailable, whether it's a fire, flood, whatever, you need to be able to recover those systems. You need to be able to recover them in the right amount of time to support your business and securely. So risk to your business. I mean, audit. This is going to be one of them. You got breach and complaint. So someone complains that they've seen that you don't handle this information well, they can go and file a complaint with, just file with you first, they can file with OCR. They may come do an investigation, or someone from inside your organization. So there's some risk. And consequences are great. I mean, the fine will go to fines. And if you do have an incident that's a breach or one of these things, you're going to want to get a good attorney that actually knows this stuff. So those expenses, and then reputation is probably one of the things is priceless, I think. So is it important? So sometimes it's talking to CFOs and CEOs, do I really need to invest in this? So who thinks it's important? The government does. They actually built a law around it called HIPAA. If your business associate or clients think it's important, and covered entities. Insurance companies, how many people have cyber insurance? Okay, that's good. I'm sure you've gone through one of those nice long applications, so they're asking you a lot of the things that we're going to go over here today. And your patients, and if you're in long-term care, your residents assume that you are doing all this stuff. So they don't think that there's any kind of gaps or anything. They come in and trusting their health care unless they get, there's an article in the paper. They're starting to see a lot of that out in the world. So what happens if we don't pay attention to this? So it's not if, it's when. So anybody can have a ransomware attack. Anybody can be breached. And it's not a question of if it's going to happen. Probably in your careers, something will happen to you. So you want to be prepared. Whether it's a random audit, for cause audits. We're going to talk about the audits here, and they're first starting at random. But other situations that can have an audit occur, a breach, security incident, affects your legal and reputation. So if something like this happens, how can you be prepared? And basically, if it happens, you want to be able to show that you were doing what you were supposed to be doing all along. So that's kind of where the audit comes in. So why HIPAA? So HIPAA was originally created to have a standard way to transmit claims, Health Insurance Portability and Accountability Act, so everybody could do billing the same way, and also so the public could feel safe about their information. So how it's shared, what hoops does someone have to go through to get it, what needs authorization, etc., what patients' rights are to medical records, and specifics. Recently in HIPAA world, but 2005 really enforced in 2010 is the security rule. Because protecting electronic information is a lot different from protecting paper, which we were all on. So, who needs to comply? Anybody self-insured health plan around here? Okay, so if you're self-insured, that's one of them, health plan. Probably in the second bullet, healthcare providers, so hospitals, physicians, anyone, in long-term care, if you're, independent living or assisted living, that built, completely private pay. This is anyone who kind of bill. If you're bill for healthcare services and you bill the government or insurance, that usually means you're a covered entity under HIPAA. Business associates. Anybody here just a business associate, not a covered entity? Okay, so they need to do all that stuff too. And then on the HIPAA entities, if you're a covered entity, a lot of you folks are probably from large organizations. You have multiple covered entities, how they're organized together. enables you to be able to share information certain ways. So there's things called affiliated covered entity. It's probably in your notice of privacy practice. This should be on there. So what's at risk here? This is for HIPAA violations. The top is I'm totally ignoring it. On the security side, I haven't done an assessment. I don't have a plan. I don't really enforce policies and procedures, et cetera. All the way down to the bottom of I've kind of got everything together, but something happened. Okay, so and that's in general. So you want to actually work your way to the bottom. Something does happen. Other costs, we talked about those. So the audit process, the 2016 audits are in process. Covered entities and business associates. So anybody on the list? Do you get an email from OCR? Okay. Oh, really? Okay, wow. Lucky. To see who you are, and then they'll send you a questionnaire, and then we'll actually pick you from those list of people to see who's in the audit pool. And these things are going to be desk audits. The initial ones are going to be desk audits, which means you get a letter and you have 10 days to get a whole bunch of stuff. I'm going to show you what that stuff is. Get that to them. So if you don't know where it is, you don't know what it is, you don't know where to find it, probably once you get the letter, and it's as of when you got the when you got the letter for the audit. So you don't have 10 days to make stuff up, basically. So knowing where things are, knowing what the information is all the information correct, and basically there's all the documentation there. So the desk audits, after that, they find issues and actually do on site, and this is kind of the first round of them. So a few hundred are going to be in the initial pool, so think of all the healthcare entities, not that much. But again, some of these other issues can actually cause organizations to come in and audit you. So, talk about the regulations. So, there's 3 legs of this, and all these are covered in the audit protocol. Security is a security rule. So that's the risk analysis, protecting electronic information, a lot of things we talked about today, incident response, I'll go through this in a little more detail. Privacy is the kind of classic HIPAA back from 2003. It's about protecting information, electronic, and who has rights to get it and what you need to do to protect that. And then breach, which is what is a breach in your organization. And Brian went through how to detect a breach. There's a protocol for that, and then to come up with is it a breach or not, breach or no breach, how you notify, training, all the way down to business associates, etc. So those are the 3 legs, and this is the federal floor. So a lot of states will have laws about breaches, even not health information. So personally identifiable information. So if your state has laws like that, you have to follow those as well. So it's a minimum HIPAA if you're a covered entity, and I think if you are here, you are covered by this stuff. So let's let's talk about the scope of these things. Security, a lot of it is about the confidentiality, making sure the right people have the information. Integrity, making sure it's correct. So now you're depending, all your paper stuff is gone, or in your back room at least, and to make sure that you're depending on this electronic information, you have controls to make sure that it's correct and it's secure, and the availability we talked about. HIPAA security rules. Anybody actually read the regs? Yes, it's kind of vague stuff, which is kind of one of the issues here. But they're broken into 4 buckets. So administrative safeguards, which are written policies and procedures, et cetera. The technical, which is firewalls and encryption, those types of things. Physical, do you know, is everything behind locked doors? Are your screens facing the right way? Do you know, have visitor logs of who's coming in your organization, who's in your computer room, et cetera? Organizational, do you know who all your business associates are? Are you tracking training, those types of things? So those are the buckets of the HIPAA. The privacy land, we talked about patient rights, how information is used and disclosed, training, business associate agreements, forms, logs, reports, and audits. I'm going to talk about that because policies, again, are something that are on your shelf. But in the HIPAA regs, there's a lot of talk about ensure compliance. So how do you ensure compliance? You have forms, you're recording, you have logs of when things happen, you're proving that you are actually following this. You have record of training. You're constantly looking at policies and procedures and revising them and keeping those logs together. And then briefs about detection, notification, training, etc. So on the security side, there's a couple ways to do the risk analysis. There's a tool out there from the government that's got 150 questions, tough to answer. It doesn't say how you have to do it. One of the accepted ways is NIST, National Institute of Standards and Technology. And they have a series of security control families, and these are some of them down the right here. And these are the iceberg, they're little tips of icebergs. So there's a lot of information between each of these bullet points, kind of things you need to do. Access control is how you grant access to information, and incident response is huge. There's a whole presentation on that this morning. Protecting your media, making sure you do risk assessment, tracking the results. So you have a plan. So you have this assessment. Sometimes you get the assessment, stick it on your shelf, and I'll get to that. You should have an active plan that you are monitoring and is surfaced to management and executives. Your board might ask for that as well. And kind of the list goes on. So that's kind of the scope here. So, so these are, the OCR audits are underway. In 2012, anybody part of the 2012 group from audits? Okay, they did a big test. Big, small, tiny, they did dentists and huge health systems and health plans, etc. And they came up with kind of the state of the state, and it wasn't too good. A lot of it was in the security side, risk analysis, etc. It took them several years to kind of come together and determine how we're going to do this again. And just in early part of April, the new audit protocol was released. So again, here's the reasons that it can happen. So the audit protocol is online. If you search OCR audit protocol, it'll take you to a place, and it'll talk about a lot of the things that I just talked about here. It's in a HTML format. I think there's a couple ways you can download it. But if you, we downloaded it and kind of put it in data analysis cube to come up with kind of these stats here. So it's 180 items, okay? So, and they cover the three legs that we talked about: security, breach, and privacy. And, excuse me, in many ways this respects kind of the breadth of the regulations. So 72 security, privacy, breach. If you look in general terms, and we'll talk about this more, there's 4 things for each item. So do you have a policy and procedure for the thing that we're talking about, whatever the number 19 or whatever? And what do you really do in your organization? Are you doing all the things that you need to do? When we look at your policies and procedures, do they have all the required elements? So are they addressing all the parts of the regulation that are important? Are they structured the right way? And then, okay, so you passed down to 3. Then now there's proof. So show me documentation. Show me all the logs and forms and revisions and how you're training and those types of things for that particular item. So there's really nowhere to hide here, right? So, can I just see your policies and procedures to get a book out? Here they are. This is more about what they really are, which is ways to live them, implement them, train on them, etc. So that's kind of an overview of them. So we broke down by the different parts of the regulation. On the security side, the number 1 is 308, which is the administrative requirements. When we talk to and work with organizations, that's usually the number 1 problem. A lot of organizations do the right thing, but it's not documented anywhere or trained. And if it's not documented anywhere, trained, adopted by the organization, there's no way to know that you're doing it. So if you ever get audited, one of the first things to do, even if you're doing all the right stuff, policies and procedures. If not, we had one situation where someone was led into an exam room, and the caregiver left, and there was 6 residents up on the screen that weren't them, right? So it's kind of an issue, not that big incidental viewing, except they took a picture of it with their cell phone, and then went out to the nursing station and said, this isn't what I've seen. So the first inclination, that's why I think getting HR involved, as Brian said, is super important. First inclination is sanctions for the particular caregiver, right? They did the wrong thing. But if there was no policy and procedure and they weren't trained on it, there's no way they could enforce that. So again, a lot of it comes down to that. So that's super important. Privacy. A lot of the first ones are on uses and disclosures, administrative part of it. Do you have policies and procedures about how you grant access, things that require authorization or don't require authorization. Remember, this is protecting the public. So if you're somewhere and it's okay for my son to have my information, but not my evil daughter, right? You should be able to do that. And your organization should be able to process that the right way and do all the necessary steps. So the uses and disclosures and the administrative part are the first part of that. On the breach side, it comes into administration too. This is training, documentation, that's the first one. There's breach notification, how you notify people, what the requirements are. There is a breach. 402 is how to detect a breach and the definition of a breach. So this is how it breaks down. So again, we'll talk about this. Policies and procedure. What do you do? So the policy procedures meet all the requirements, and then documentation to back it up. So with that, I'm going to take a tour through the audit protocol here. So, I'm pretty good. You see that? This is a little bigger. So this is kind of the way it's structured. So there are security, privacy, breach. You can kind of go through and want to bring up all the privacy ones. These are all the privacy ones. You can see there's an item usually covers a subset or a part of one of the regulations. We kind of wrote this out what the parent regulation is. The section that you're talking about, this isn't secret stuff. This is all in the regulations. What the activity is that you're looking at, and then the criteria. So these are the parts of the regulation that they are actually going to measure you on. And then and this is the switch over one. So this is the audit inquiry. So for a particular item, again, policies and procedure in place. It may have some detail. If a lot of the privacy regs, there's some nuances. If you're a hospice, there's some other things you need to do. If you're a pharmacy, if you're long-term care, depending on what you're doing, there's little nuances. So it doesn't pertain to your business. And again, policies, procedures, etc. So this is a lot of the stuff that will be asked of you to provide. So give me all your policies and procedures. They'll check to make sure this is what the auditors are looking for. Do they have all the required elements? Show me documentation. Show me. I'll kind of drill into one that you've been following it, logs, etc. And they need to be up to date. So that's kind of a walkthrough. We're going to go into a privacy. Oops, privacy right here somewhere. So this is authorizations for breaches and disclosure that's required. So one of the things we're looking at, if you have a policy and procedure, does it contain these elements? Now, policies are kind of funny because, especially the way the regs are written, a lot of times you want to put in what you think the regulations mean, which is sometimes that works. But what you don't want to do is leave it to interpretation. So a lot of times it's good to put these things in as worded. Security is a little bit different because it doesn't really map well to the regulations. But you should be able to look at your policy and go through each of these things and say, is that in there? So that's is it required? And then, so you've done that step, and then you come over here, and then this is all about authorization. So do they exist? Do they have all the required elements? And then sample authorizations obtained. So give me samples from real patients in your organization where this has occurred. So, so I'll talk about kind of how to prepare for this. So that's one of the that's kind of the way it works, and it kind of works over and over again. So let me take this to my favorite ones, the security side. Conduct a accurate and thorough risk analysis. So this is a thing that you've had to do for meaningful use. A lot of the things right here are security management process, et cetera. So you have come across, and you've got, okay, so do you have policies and procedures around risk assessment? Do you have policies that we need to do one, a certain time frame, update them, et cetera? Have you conducted one, and does it meet all these required elements? Detailed scopes of all your systems, that's a little bit different from the, in some degrees for meaningful use. Details of threats and vulnerabilities, assessment current measures, likelihood analysis, risk rating. So if you have an assessment and it doesn't have all these required elements, then that would be a problem, and require documentation. So when you've done it, your past assessment can be updated, et cetera. So this is an example on the security. Going back to